Hi, everybody. I'm Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District in the U.S. House of Representatives. As a co-founder and co-chair of the Black Maternal Health Caucus, one of the largest bipartisan caucuses in Congress, I am delighted to be joining you for this event, and I am grateful for your commitment to saving moms' lives and ending our nation's maternal health crisis. As you know, the United States is in the middle of a maternal health crisis, and this crisis is getting worse, not better. In 2021, the maternal mortality rate was 89% higher than the rate in 2018, even though more than 80% of pregnancy-related deaths in the U.S. are preventable. At the same time, more than 1,000 counties in our nation have zero obstetric providers, and over half of rural hospitals in the U.S. don't offer maternity care, placing the lives of moms across our nation at risk. These statistics are devastating, but for many of us, this crisis isn't just about data, it's personal. In January of 2017, I lost my friend, Dr. Shalon Irving, to pregnancy-related complications just 3 weeks after she gave birth to her first child, a beautiful daughter named Soleil. As I've done this work, so many people have shared their own stories with me, losses and near misses, tragedies that could have been prevented. The causes are multifaceted, but we know that solutions exist, and we know what to do to end this crisis. We just need policymakers to invest in comprehensive solutions to end the maternal health crisis and to invest in the people, agencies, and organizations that are doing the urgent work. To address all the drivers of our nation's maternal health crisis once and for all, we need to advance comprehensive policy solutions. So, Congresswoman Alma Adams and I wrote that solution. It's called the Black Maternal Health Momnibus Act, also known as the Momnibus, and the time for Congress to pass it is now. As the lead sponsor of the Momnibus, I was so proud to introduce the Momnibus with then Senator, now Vice President Kamala Harris. Since then, working with Senator Cory Booker, Congresswoman Alma Adams, and now more than 200 co-sponsors between the House of Representatives and the Senate, we've made huge progress. The Momnibus is a sweeping package of 13 evidence-based bills. It's the only federal legislation to comprehensively address every driver of maternal mortality, morbidity, and disparities in the U.S. And when we say comprehensive, we mean comprehensive. The Momnibus includes investments to grow and diversify the perinatal workforce, improve data collection, fund community-based organizations, expand access to housing, nutrition, and healthy environments during and after pregnancy, and support moms with mental health conditions and substance use disorders. And we've made real progress in moving the Momnibus forward, including having the first bill from the Momnibus enacted, the Protecting Moms Who Served Act, which invests in world-class maternity care for our veterans. In 2021, I was so excited to go to the White House and see President Biden sign the Protecting Moms Who Served Act into law, a moment that reflected years of hard work and advocacy from so many people. The Momnibus also makes investments directly and specifically in community-based organizations, providing historic levels of funding that would allow organizations across our country to continue life-saving work and spread models that they've developed to every community across the U.S. Last year, operating under a divided Congress, we increased funding for key maternal health programs, including new funding based on the Momnibus, over $100 million. That money is already rolling out to communities across the country, and we're just getting started. The Black Maternal Health Caucus is here to serve as a clearinghouse and a resource to you. You can find us on social at BMH Caucus. We know that without passing and fully funding the entire Momnibus, we won't be able to make the comprehensive investments that we know are needed to address our nation's growing maternal health crisis. We are so close to getting the entire Momnibus across the finish line, so close to ensuring that everyone has access to safe, respectful maternity care and robust social support that they need and deserve during pregnancy, throughout labor and delivery, and for the full year-long postpartum period and beyond. We must build on our momentum and pass the full Momnibus now. Our nation's maternal health crisis impacts rural, urban, and suburban communities. And while the racial and economic disparities are huge, this crisis is so big that it's affecting families in every community across our country. By passing the entire Momnibus, we can save lives. And we can do more than prevent moms from dying. We can ensure that pregnancy and childbirth are not a time of fear or danger, but the experience of joy and wonder that every family deserves. Thank you for the work that you're doing and your commitment to addressing these urgent issues. I am grateful for the light that this event is shining on maternal health in the United States, and I hope that it inspires everyone to take the action that we know is needed. Thank you for the opportunity to join you today. I hope to see you in person soon, but until then, take good care of yourselves.